The first model is the biopsychosocial model, and this was proposed by George Engel. And according to this model, biological, psychological, and social factors all work together to contribute to health and disease, and it's based on 3 principles. The first principle is that disease is a result of multiple factors and not just the biological factors. And secondly, an individual is composed of a complex, integrated system, and it consists of the elements of mind, body, spirit, and social relationships. And any change in one of these systems will cause a change in the other systems because they're all linked. And thirdly, biological, psychological, and social factors form a triad and determine health and illness. The biopsychosocial model includes the use of interventions that don't involve surgery or drugs, and these are called the non-pharmacological interventions, and these will be discussed later on. The BBS model can be used clinically by considering the biological, psychological, and sociological factors that contribute to some disease. For example, in the case of dengue fever, at the biological level, there is the breakdown of the body's reticuloendothelial system. At the psychological level, the person may have risk-taking behavior or inappropriate dressing in high-risk settings. And the social factors that may be involved include, for example, the poor drainage of water or poor disposal of waste. The next model is the integrated healthcare model, and it's one step ahead of the biopsychosocial model because it states that well-being is because of the link between 5 different domains. These include biological, behavioral, social, environmental, and cognitive domains, and these all contribute to the well-being of a person. It's based on 2 things, homeostasis and allostasis. The purpose of homeostasis is to ensure that the internal conditions of the body remain constant even when the environmental factors are changed, and this is through negative feedback loops. And the purpose of allostasis is that it's an adaptive mechanism that makes an individual predict the changes in advance. So for example, it's a very hot and summer day. An example of homeostasis would be to increase your intake of fluid and salt. And an example of allostasis is that you would try to organize your work schedule beforehand because you already know it's going to be a very hot and tiring day, so you plan your schedule ahead. This model also includes 2 other concepts, the concept of eustress and distress. Eustress is basically the optimum degree of stress which is necessary for a person to stay healthy. And distress is the state in which both the homeostatic and the allostatic mechanisms are challenged by extrinsic or intrinsic factors. And if these homeostatic and allostatic mechanisms fail to correct these factors, this results in disease and illness. The third model is the public healthcare model, which deals with primary healthcare, preventing illnesses, promoting health. And the purpose of the public healthcare model is not only to treat the disease, but also to prevent the disease. The goals of the public healthcare model is to treat common diseases and basic health issues in primary healthcare centers. And in Pakistan, these include basic health units and rural health centers. And they involve various campaigns like immunization campaigns, mother and child health programs, reproductive health, HIV and AIDS programs, and programs for mental health, narcotics control, malaria, and dengue.